Swadikap and good afternoon once again. Today is Thursday, the 29th of April, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as always. And as you can see, we've continued to be wearing masks as we go on air live for all of you. To set as an example, to have a visual so the audience can see that we are very serious in promoting the necessity of wearing masks. So first of all, thank you to Dr. Tweesin for the Thai language briefing that we had just now. So later on this afternoon at 2 p.m., we will be having the general CCSA meeting, which will be chaired by the Prime Minister, and many important measures, some new measures, some updated measures will be discussed and finalized and approved, and we will be coming out with the results of the meeting in due course. Dr. Tweesin also mentioned every day about the statistics and the numbers that we have in the global numbers. So Thailand is kind of like going up the rank a bit, around 106 compared to other countries around the world. We hope that we won't be that ranked highly in the days and weeks ahead. Our neighboring countries, our friends in the ASEAN region, our hearts go out to them. We have, for example, in Malaysia, Cambodia and Laos, the situation there, our heart goes out to them. In Malaysia, as you can see on screen, the numbers are fluctuating, going up and then down and then up again. In Cambodia and in Laos PDR, the numbers that you see on the screen are quite steep. The graph is quite steep. So hoping that our friends in the ASEAN region will continue to be able to contain COVID along with the efforts that we have here in Thailand. Dr. Tweesin also talked about working from home as being very, very important, and ordering food, which I think many of you are doing right now, ordering food for delivery and consuming them at home, as opposed to going out to restaurants and with the risks of going out to public places. So working from home is very important, and we continue to encourage all organizations. The government has been doing this for many weeks now, so we encourage many companies in the private sector to do this as well, if not already. So I'll move on to the number of cases recorded for today. We have new confirmed case for today, 1,871. The active cases that remain to date now is 27,988, as you can see on screen. Now, the number of new confirmed cases, 1,871. Out of that number, the majority, 1,830 cases, are from local transmission. 34 cases are from active case finding. Active case finding still continues, although now the positive cases found from active case finding make a small percentage of the total number of cases per day. Also, 7 cases are from within the state quarantine system. So 1,871, a lower number than the past days, wherein we reached 2,000 plus per day. So that's good news, hoping that the number will decrease in the coming days and weeks. We have, from the number of cases still under treatment, active cases, 27,988. Now, of that number, 786 are cases of critical condition, and out of 786 cases, 230 cases are patients on ventilators. We have 992 new recoveries today, as opposed to 1,871 new confirmed cases. And new fatalities, unfortunately, were in the tens, still in the tens. 10 new fatalities, making the cumulative number of fatalities in Thailand at 188. These 10 new fatalities, we have 8 male and 2 female. The age range is from 45 to 91, with the median age at 62. In terms of location distribution, the 10 new fatalities are 6 from Bangkok, and 1 each from Nakhon Sawan province, Samut Prakan province, Yasothon province, and Ayutthaya province. These 10 new fatalities, we have 2 of them infected from family members, 2 from having meals with infected colleagues, and the rest, the remaining 6, infected from various sources, such as attending seminars or visiting entertainment venues. Overall, the provinces with the highest number of new confirmed cases are Bangkok, firstly, with 689, followed by Samut Prakan, 151, Chonburi, 112, Chiang Mai, 89, and Pathum Thani province at 81, and the remaining numbers in other provinces. So just in terms of observation, might be having some maps coming up for you to see. So just in terms of observation, firstly in terms of the provinces that have been announced in terms of the mask wearing, as well as the provinces that have announced the requesting the cooperation from the general public to not leave their homes at night. So note that, of course, this is not a curfew. We've never announced a curfew, but this is 12 provinces you see on screen now that have announced that they request for the kind cooperation of the people in the area not to leave their homes from various times. For example, from 2100 hours or 2200 hours or 2300 hours, 9, 10, or 11 p.m. mostly until 4 a.m. in the morning. And you see that on screen. It's mostly in Thai, but just a general picture that you see that 12 provinces colored in blue have announced that request for cooperation. And also, as I mentioned the other time about mask wearing, that many provinces have announced that mask wearing can be fined, you're not allowed to not wear masks. You have to wear masks when in public in these provinces. So in the past days, I've announced this already. It has been a number of provinces. Now, the number of provinces have increased to almost the entire country already. So 73 provinces out of the 77 in Thailand have already announced that if the public go outside of their homes and do not wear masks, they can be fined and can be penalized. So moving on, the vaccine issue, I'll just mention that a bit. As of today, more than 1.3 million doses of vaccines have been administered in Thailand already, with more than 1 million people already receiving their first dose, and about 280,000 fully vaccinated. More than half of those who have received the vaccine are health professionals, and around 30% are people living in high-risk areas. Also, yesterday, the Public Health Ministry also had a meeting with AstraZeneca to follow up on vaccine production by Siam Bioscience, and the company confirmed that it has been completed the technology transfer, and 2 batches of vaccine samples have passed the quality tests. Each batch of the vaccine undergoes more than 60 different quality control tests, and vaccine production and distribution remain on the schedule and should be ready on time according to the vaccination plan in June. Furthermore, the Public Health Ministry has also been negotiating with the representatives of other companies, such as Pfizer in Thailand, to procure more vaccines to reach the target of 100 million doses by the end of this year. As the Pfizer vaccine has passed the study and confirmed that they are safe to be used among adolescents aged 12 to 18 as well. The government aims to obtain the vaccine to inoculate young people at that age group to prevent infections in schools and academic institutions. So during the CCSA daily meeting this morning, the Health Ministry affirmed that all people who reside in Thailand, regardless of nationality, are eligible to receive the vaccine under the plan, and will inform you about the vaccination plan for foreign nationals as soon as it is available. Now, cooperation with the private sector. Yesterday, the Prime Minister discussed with the private sector on speeding up the vaccine rollout, and you'll have some images coming up on screen for you there. Yes, the government approved the private sector's proposal to set up teams comprising of several companies to help increase the vaccine drive. So, for example, a team dubbed Team A will be responsible for assisting in the distribution and logistics and providing support personnel and equipment. And Team B, for communication, will help to explain and allay the people's concern about the safety of vaccines and persuade them to be inoculated. And Team C, dubbed Team C for IT operations, will help develop the vaccination registration system and provide technical support for the MOPROM official program of the government. And Team D, lastly, dubbed Team D for extra vaccine procurement, will work excuse me, with state agencies and explore the procurement of alternative vaccines. And over 200 Thai businesses have offered to make their premises, their venues available to the public as vaccination centers. And businesses include hotels, shopping malls, and commercial banks. So this is something very constructive, very positive to hear from the cooperation of the private sector as we move towards the period where we'll be having massive vaccination come the coming months according to our vaccination plan. Now, just one last piece of information is about that in the CCSA meeting this morning, the Public Health Ministry presented the result of a study about the risk of transmission in various venues in the current outbreak. The ministry found that around 44% of the new confirmed cases received the virus from having close contact with other infected persons, especially family members. And you see that on screen, 43 on the top right in blue, 44.3%. And this information was conveyed in the Thai language version yesterday by Dr. Tawisin. So around 44% of the new confirmed cases from having close contact with other persons, especially family members. Around 25%, you see on screen, 25.2%, have been infected after visiting entertainment venues, such as pubs and bars. And other venues are found to be of the source of transmission, including markets, workplaces, restaurants, cultural events, and concerts. This piece of information is very important because the CCSA will be using it as a rationale in adjusting, in updating, improving the disease control measures. The general CCSA meeting this afternoon, for example, will be one meeting where we will be using this kind of information and statistics to improve or come up with new adjustments in our measures. The general CCSA meeting this afternoon, as I mentioned, will be chaired by the Prime Minister, and we'll consider these to tighten measures for some areas as appropriate to prevent the spread of the virus. So this is the information I have. Please stay tuned for the results of the very important CCSA meeting that we will be having this afternoon at 2 p.m. It'll also consider